This hearing will come to order. Good morning and welcome to this morning's hearing on the integrity of insurance premium subsidies under the health care law. Last month, this subcommittee and the Subcommittee on Health held a hearing that showed the administration's failure to implement effective eligibility verification systems would result in billions of dollars in improper payments going out the door and unexpected tax debts for families across America. This morning, we turn to the question of whether the federal exchange has sufficient controls in place to verify income and identity verification, including Social Security numbers, names, and other information. On September 12th of last year, Chairman Camp, Senators Tom Coburn, Orrin Hatch, and I wrote to Comptroller General Gene Dodaro asking that the Government Accountability Office conduct testing to determine whether the administration had in place appropriate internal controls to prevent fraud and abuse in the health insurance exchanges. We asked that they do this through the GAO's Forensic Audits and Investigative Service, a team of forensic audit and investigative professionals who conduct special investigations and fraud assessments. To test these internal controls, GAO went undercover, created 18 fictitious identities to apply for insurance subsidies online, over the phone, and in person. When GAO applied for premium subsidies online or over the phone with fictitious names, Social Security numbers, and documents, it succeeded over 91% of the time. When GAO went to seek help from taxpayer-funded assisters, 5 times out of 6 they were turned away or unable to find help. When GAO sent in fake documents to support their applications, federal contractors accepted those documents. Sadly, this is not terribly surprising, but it's really disturbing. Time and again, the administration has chosen to either ignore the law or when it does implement the law, does so with a level of incompetence. The administration decided the employer mandate would harm its political and electoral interests, so it delayed the mandate. The administration found that the words of the law would prevent it from implementing federal subsidies in a way it preferred. It ignored the law, and as the D.C. Circuit ruled yesterday, when the administration sought to implement the federal exchange and created healthcare.gov, the website crashed spectacularly. So when the administration began issuing billions of dollars in subsidies, we found that it did so without regard to protecting those taxpayer dollars from improper payments. This is not simply a question of whether one likes the President's health law or the way this administration has gone about implementing it. The question really is whether the administration is being a good steward of taxpayer dollars and putting in place adequate controls to protect those dollars from fraud, waste, and abuse. This is about whether these subsidies are actually going to those who really need them and who qualify for them appropriately. The history of the health care law's implementation suggests that the answer has been no. Today, we hear from Seto Bagdoyan, the acting director of the Forensic Audits and Investigative Service, on GAO's preliminary findings in this matter. I want to thank him and GAO for this work and look forward to your testimony, Mr. Bagdoyan, and also look forward to continuing to work with you